This is the very important definition. You will be asked in the Viva, what is the meaning of pathology? Pathos and logos. Pathos and logos. You can make a very short notes, very few questions will be there from today's lecture, as this is just an introductory one. Pathos means suffering and logos means study. This is a Greek word. So study of suffering, study of suffering. This is a very important basis of your medicine because first you have to learn, this is like a step. First step is physiology, then you learn pathology and then you learn medicine. So if you don't read pathology well, you will not understand medicine well. So this is the very important basic starting step of medicine. These are the names you need to remember. Please note it down. Will be asked in Viva also and later also in your MCQ exams. Paul Ehrlich. This is the one, father of clinical pathology, father of clinical pathology. Right now you just need to know the name, but later when you appear for the PG exams, there may be given some pictorial questions also. Okay. Father of clinical pathology, Paul Ehrlich. Father of exfoliative cytology. I will explain the subjects later. Just know the names for now. Exfoliative cytology is George N. Papanicolaou. He is a very important person. We will later know many tests, many examinations and many stains in his name. George N. Papanicolaou, father of exfoliative cytology. Museum in pathology, this is an important one. John Hunter, a Scottish surgeon. Okay. This is also very important. Father of blood transfusion, you may already know from physiology. You have read in physiology, I guess. Karl Landsteiner. And father of cellular pathology is Rudolph Virchow. Have you read Virchow's triad in physiology? Virchow's triad, you know anyone? Anyone? Okay, we will discuss it later then. For now, write down the names. Okay, so what are the subdivisions of pathology? Before that, anyone bought any books so far? Pathology boi keu kineche? No books so far. So write down the names you need to buy. Mohan's pathology. Mohan. These are the only 2 or 3 books that I am asking you to buy physically. Rest you can do in PDF or anything. But one at least physical book must be there for you. Mohan's pathology. This is for the text. Another one is Robbins pathology. There are many versions of Robbins. I have a smaller version and medium version and a larger version. Whatever suits you, you can read. But Hirschman is must for undergraduate level. Okay. And practical also, you have to buy one book, P. Chakraborty. This book is available in College Street, I think. You can go there and collect it. P. Chakraborty. So this is the theory book and this is the practical book. Rest you can do from PDF or whatever. But one, at least you should have one book. And from the beginning you should point all the definitions. General pathology, we will start with general pathology. The definitions must be remembered exactly the way it is written there. Okay. So what are the subdivisions of pathology? We have just learned that it is the physiology is the base. The problems in physiology is pathology and then the treatment part is medicine. So now we will learn what are the parts of pathology. There are many subdivisions. General pathology and systemic pathology. General pathology and systemic pathology. So as it says already dealing with general principles of the disease. General pathology deals with general principles of disease. Here we will learn all the mechanisms, all the basic definitions, what causes the disease, what are the mechanisms behind the disease, which is called pathogenesis. And systemic pathology, already named there, systemic pathology means system-wise we will go. General pathology is the basis and systemic pathology is system-wise, like CVS, respiratory, renal, system-wise we will go and discuss according to the diseases. So it deals with the study of diseases pertaining to specific organs and body systems. Subspecialties, you just need to know some names. These are the main important things. Histopathology, you need to know the terms. Histopathology. hematology and clinical pathology. You have any idea about what is histopathology? What it contains? কেউ জানো? কি নিয়ে ব্যাপারটা histopathology? Any idea? Diagnosis to histology. সেখানে আমরা কি ইউজ করছি? We are using the surgical specimens. All the surgical specimens we are cutting and making the tissue sections, and from there we are diagnosing the diseases, the cancer and spread of cancer, like that. So histopathology is very important part. Next is hematology. As you all know, hematology is all about blood. So CBC, complete blood count, and all other parameters. There are maybe abnormalities also, like we will read later, leukemia, lymphoma. Leukemia is very important, so we will read it separately along with the slides. And clinical pathology. Clinical pathology contains the other body fluids like urine examination, CSF examination. তোমার কি এতে যাও? You go to the ward right now? Not yet. Okay. So you will see later that we collect fluids. The ascites patients, we tap and get ascitic fluids. Pleural effusion, we get pleural fluids. Those are the things we take in slide and examine under microscope to see if there are any malignant cells. This is under systemic clinical pathology. And many other things also, like semen analysis. These are also under clinical pathology. So this is the definition of histopathology. Definition: it is a branch of pathology which deals with study of disease in a tissue section. Tissue section. Study of disease in a tissue section. We will later discuss the steps, how it is done. And you will also visit the labs also sometime to understand the process. See, the tissue undergoes a series of steps. The tissue undergoes a series of steps. First we take the specimen, then we cut it into smaller halves, and the required tissue section is taken. So it undergoes a series of steps before it reaches the examiner's desk to be thoroughly examined. So to achieve this, it is important that the tissue must be prepared in such manner, sufficiently thick or thin. Just randomly we cannot cut the section. So what is clinical pathology? As I already explained to you, the branch of pathology dealing with study of disease and disease processes by the means of chemical, microscopic and serological examinations. Chemical, microscopic and serological examinations, 3 parts of clinical pathology. Study of disease and disease process by chemical, microscopic and serologic examinations. Hematology, as we already discussed, the branch of medicine involving study and treatment of the blood. You did not know into the details, but just the names will be sufficient. These are the steps. Histopathology, how it is done. Histopathology is a department in the clinical laboratory which deals with the study of different types of tissues. What are the steps? Processing, grossing, tissue processing, embedding, immunohistochemistry, special staining, cytology and cytogenetics. You just need to know the terms, what it means, so that you understand the process going behind, and we will discuss that now. Cytology, anyone heard of the term cytology? Have you heard the term cytology? Study of cells, yes. That we do by, there are various swellings in the body, like a parotid swelling, like a thyroid swelling, or a breast swelling. So we do a process called fine needle aspiration cytology. It is a very important part, you must learn later. Fine needle aspiration cytology. Ki kore, we take a needle and prick the swelling area to take some cell materials from there and make the slide and see. This is the basic of any cancer or tumor or any swelling. First we have to do the cytology, the cellular materials, the staining. If we see any kind of problems there, then we would go to the next step. Special stains we will discuss in detail in later classes, and it's very, very important for examination. Special stain and also the tissue processing. So it is already, no need to repeat again. Processing. For the processing, what are the materials? What are the materials we take? As we already discussed, one surgical specimen like tissue along with its history. When we get a tissue, like a gallbladder operation is done and the specimen is sent to us, along with the history must be given. What was the purpose behind the surgery? So that we get a clue to what might be there in the cell. Tissues with history, if bone can be given, there are very many bony tumors also. So parts of bones or bone chips may also be given. So bones are also given along with X-ray. Autopsy along with consent form. If any dead body is there and for the learning purpose or for research purpose like that, we use body materials. For that we need a consent form. Body fluids, as we already said, body fluids like CSF and say pleural fluid and ascitic fluid, okay, and CSF. These are like the typical tables of histopathology section cutting areas. See, these are like the smaller containers where the tissues are sent to us. This one you can see the large container, yellow one, where a large tissue like uterus. Uterus is a larger tissue, so we need a larger box. So, after the tissue processing, the first step, what is now done is gross section, gross section. We first take the specimen and do a gross section. So, what is written there? Specimens are inspected, further microscopic inspection. These are the, first we look for the outside, what is the color, what is the consistency. Color and consistency gives us many vital clues about what might be there beneath the tissue. For there, see, yellow in case of liver or renal, green in case of routine, white in case of bones, gray in case of the skin, and pink or pinkish in case of lymph nodes. If there is something different, there may be some problem. Green, where can you find? In the gallbladder. You have to give examples. When you are asked about the color, you have to give examples. Green color we see in the gallbladder inner wall. Why? Gallbladder ki thake? Bile. Very good. Right. Because of the bile pigments, the biles are greenish in color, so the wall is usually green. But why we are discussing the color? In case a gallbladder wall is very thick and the color is not green or whitish, it may be a sign of malignancy. It may be a sign of malignancy. So when we are doing the grossing, we have to point there, the color is bile stained means green or non-bile stained means white. Bile stained, non-bile stained, greenish, white. That's why color is important. That's why we are discussing it. Color may also be an indicator of what is beneath, benign or malignant. This is a typical grossing section area. See, the girl is doing some cutting. The next is tissue processing. After we do the sections, we must process it properly, otherwise there will be, the cells will be autolyzed or cells will be dead. We cannot properly see it if it is not properly preserved. For that, what can we use? Any idea? What can we use? Formalin. Formalin, you have heard of formalin, na? Formalin. We use formalin to preserve the cellular structure and integrity. Cellular structure and integrity must be maintained. So, here you see fixing the tissue into paraffin, dehydration and clearing. Tissue is infiltrated with the embedding agent. Tissue processing always automated for the large volumes of tissues. See, earlier during our undergraduate days, the most of the tissue processing were done manually. Like there were 10 big jars and there was 10% formalin, 20% formalin, 30% formalin like that. And we used to change the things from one day to 24 hours in 10% formalin. Then next day we are giving into 20% formalin. But now everything is automated. There is an automated machine. We need not do it manually anymore. So automated is very good for the large volume of, while there is a big lab, while there are many surgical specimens happening, it is very difficult to do manually. So we are going for the automated versions now. See, this is the automated tissue processor. Automated tissue processor. During the PG examinations, you may be given this kind of pictures which are very close to each other. And 4 photos are given, and you have been given the question, what is the machine here? Embedding. Next process. So what was the earlier one? Tissue processing and see, tissue processing, gross section, general processing, gross section and tissue processing. तो দুবার processing কেন বললাম? দুবার processing কেন বললাম? Number 1 we are also saying processing, number 3 we are also saying processing. One is processing before grossing. See, ধরো একটা ওটি হলো ফ্রাইডে স্পেসিমেনটা আমার কাছে এলো, কিন্তু আমি গ্রসিং করব মানডে, তো তার আগে অবধি সেটাকে প্রিজার্ভ করতে হবে, দ্যাট ইজ প্রি গ্রসিং প্রসেসিং, দ্যাট ইজ দ্য স্টেপ 1. And the step 3 is after we have done the section, the processing of that very section is number 3. That's why দুবার processing আমরা বললাম. Okay? So next we go to the number 4 step, that is embedding. Embedding. You need to know the definition of embedding. Orientation of tissue. Orientation of tissue. I have simplified the definition so that you can remember easily. Orientation of tissue in melted paraffin. Orientation of tissue in melted paraffin, which provide a firm medium for keeping all parts of tissue intact. Which provides a firm medium for keeping all parts of tissue intact. যেটা আমরা আগেও বলছিলাম যে we need to keep the cellular structure intact. যদি সেল মেমব্রেনটা ভেঙে যায়, সেল ওয়ালটা যদি নষ্ট হয়ে যায়, তাহলে we cannot see it properly, we cannot diagnose. So for that we need to do this embedding. What is the temperature needed? Temperature of paraffin is 58 to 60 degrees Celsius. The next step we done is cutting. You will all see the steps one day in the lab, and then you will understand it more easily. Right now it is like a big bland, just the theory, but you need to know that to understand the actual process when you see it in the lab. So next the cutting is done. Microtome used to cutting about 3 to 5 micron. This is what I was talking about, the proper thickness. একটা টিস্যু হয়তো আমি এত মোটা করে কাটলাম যেটা মাইক্রোস্কোপে দেখাই যাচ্ছে না, অনেকগুলো লেয়ার হয়ে গেছে। সো উই নিড টু ডু দ্য অ্যাকচুয়াল প্রপার থিকনেস সো দ্যাট মাইক্রোস্কোপে ক্লিয়ারলি প্রত্যেকটা সেল দেখতে পাওয়া যায়। দ্যাটস ওয়াই উই ইউজ দিস ইনস্ট্রুমেন্ট কল্ড মাইক্রোটোম। Microtome is used for cutting and making thinner sections. Next, H&E is the staining. After we are doing the section cutting and everything is done, we need to stain it so that we can differentiate the cells. We will discuss it elaborately later also. Normal stains, usual stains, special stains, for what kind of cells, what kind of special stain is used. It is a very important practical and Viva topic. So here we are talking about the most commonly used general H&E, Hematoxylin and Eosin. The full form of H&E is Hematoxylin and Eosin. Hematoxylin and Eosin. See, Hematoxylin is the water-based dye and Eosin is the counter stain. পরে কিন্তু এটা স্টেপস পরীক্ষায় ধরা হবে, লিখতেও দেওয়া হতে পারে। So, see, they stain the nucleus and cytoplasm. See here this is the microtome. This one is the microtome. The girl is rotating the instrument and thinner sections are being made. I will let you see what happens sometime in the histopathology slide lab so that you can understand it better. So this is like a typical bench where we work. This is a very important question, separate question, immunohistochemistry. Earlier we were discussing H&E, that is a normal stain. Usual stain is H&E, and this is a special method. Immunohistochemistry is done to assess a specific kind of tumor. Immunohistochemistry is a process done to assess a specific kind of tumor. See, antigen-antibody specific reaction. Microbiology have started, or you will, the first class is also today, na? Microbiology first class. So later you will understand once you read these things, antigen-antibody reaction, antigen-antibody reaction. This is the basis of immunohistochemistry. Why it is done? So, for the clinical diagnosis and distinguishing the diagnosis of tumor. Distinguishing diagnosis of tumor. Key problem, there are many kinds of tumors which look alike. Many kinds of tumor which look alike, very close, resembles each other. But the treatment is vastly different. Very close looking to tumors, but treatment is vastly different. So if we do a mistake, the treatment will be wrong. That's why we need this kind of advanced techniques like immunohistochemistry, so that we get the exact diagnosis and the treatment goes accordingly. See, can be used to locate particular cells and proteins, and can be used to identify cellular events like apoptosis. Apoptosis, have you read already? Okay, good. This is another picture of the tables, the technicians, technologists working. Special stains. This is also a question. So we have many potential questions from today's discussion. However, it is an introductory class, but like immunohistochemistry and special stains, these are all very important questions. So, see, required when diagnosis is not identified. Special stain is required when the diagnosis is not identified with the usual H&E staining. जो normal staining से जो नहीं हो पाएगा उसके लिए ही special staining लगेगा. So, some of the examples here. Connective tissue. Connective tissue. To stain the connective tissue, we use trichome. Meson trichome or rapid trichome. Meson trichome or rapid trichome. For the special staining of the nucleic acids, we use methylene green pyronine. And PAS is a very, very important special stain. PAS, periodic acid shift. PAS, it is used for carbohydrates. We will discuss it later. Just know the names for now. This is a special stain table. See, all the parts of special stains are given here, and according to the minutes given, you have to know also the timings. So, which are the steps, how many, for the how much time it should be kept there for proper staining. Also, I will show you the slides later. What mane kirokom color nay, kon special stain kiram color nay. It is very important to know and understand. Cytogenetics. Cytogenetics. What is cytogenetics? This you know a bit because of you have already covered physiology. See, study of the chromosomes and its abnormalities. So, the chromosomal abnormalities, Turner syndrome, Down syndrome, Klinefelter syndrome, like that. So, with this method, we see the chromosome number, the structure, function, and behavior in the relation of inheritance, like X-linked recessive, like autosomal dominant, like that. The inheritance, pattern of inheritance. Mendelian, যেরকম আমরা আগে পড়েছি. Organization and expression of the genes. So what are the types of disorders? Deletion, inversion, translocation, and insertion. Deletion we have done, XO, and insertion is XXY, similarly. Okay? This is called cytogenetics. So what are the types of specimen? This is already discussed. We are just repeating. Blood, bone marrow, amniotic fluid, and procedures done are karyotyping, G-banding, and FISH. All are potential questions. Karyotyping, G-banding, and FISH. Especially karyotyping and FISH. Both comes as questions. Okay? So these are potential questions. Amniotic fluid se kya dekhna padta hai? Amniotic fluid, what we do it for? To see any abnormalities in the baby. Okay? This is a computer assisted model where the karyotyping is going on. Cytology, as we have already discussed in the beginning, study of cells. Cytology means that one. I was saying that tumor and we take the cells from there, the beginning step, that is cytology. Study of cells to know the infection and pre-malignant and malignant changes. The initial pointing as pre-malignant or maybe malignant is done via cytology. What are the types of samples? Gynecology, pap smear. Here see how these things are connected. This pap smear, see the name? Pap smear. This PAP name is from which one? We have already discussed about the scientist George in Papanicolaou. We have already seen. This is in his name. So that's why this person is very important. And non-gynecological, like we already discussed, CSF, urine, pericardial fluid, pleural, ascitic fluid, etc. Synovial fluid also. Procedures are done that we said FNAC, fine needle aspiration cytology, and FNAB means biopsy. Biopsy and FNAC. In cytology also we are doing that H&E stain, we already discussed before, and more than that we are doing also PAP and GIMSA, Leishman, GIMSA and PAP. Slowly you will know the names and understand the steps. Semen, as we are already talking about it, semen, the diagnosis of, in case of infertility, it's very important, and also in case of paternity dispute. And as you know, this day is these are the age of medico-legal aspects. So we case many POXO cases. POXO cases, you know, POXO Ain? Yeah, he knows. So it is with involving the minors. 18 বছরে কম মেয়েদের ক্ষেত্রে যদি কোনো সেক্সুয়াল অ্যাসল্ট হয় তো দ্যাটস আন্ডার পক্সো অ্যাক্ট দ্যাট টাইম টু indicate the person who is behind this, we need this kind of tests. That's why it's very important. So semen analysis, what we do, liquefaction, what we see there, write down the points. Just what are the points to be covered in a semen analysis? Points covered in a semen analysis. Liquefaction time, motility, number, morphology. Morphology means normal or dead or like that. Motility is progressive or non-motile. Okay. So what are the things we are seeing? Elements, the quantity, the color, liquefaction time, and pH. pH is also an important indicator. Tests what are done, detailed report, intrauterine insemination. That's what I was talking about, the in vitro fertilization techniques these days used for infertility. And anti-sperm antibody. Anti-sperm antibody, you will learn later that anti-sperm antibody works with antigen-antibody reaction and causes infertility. So for the diagnosis of these things, we need to do these tests. So this is the basis, we are more or less done. So what you understood, what is the first thing we will do if someone is coming with a small tumor? What is the first test we will do? What is the first test we will do? নামগুলো মনে আছে কিনা দেখতে চাইছি। FNAC, cytology, FNAC we will do first, okay? First we will, আমি আমার প্যাথোলজির কথা বলছি। Obviously first we will do the radiological examination like USG. First, like someone is coming with a thyroid swelling. So we will first want an USG report. So how much the swelling is there? Left side more swelled or right side more swelled? Is there any other abnormality? Is the blood flow is normal? These are the things we will get from the USG report. Then we will do the FNAC. With the FNAC material, we will do the stain and special stain. Just understand the processes, basic process, stain and special stain. From there, if we get any kind of signs of malignancy, then we will revert it back to the surgeon. And if he wants, then he will do the surgery. If the thyroidectomy may be done, if there is malignancy or any other indication. Then after that thyroidectomy surgery, that thyroid itself comes back to me, and then what we do with the surgical specimen? Histopathology. Okay, this is the whole cycle of the pathology, just to make you understand how it happens. It's like a cycle. Everything makes sense when you understand the basic points. So now your work is, you buy the Mohan book and start reading the basic, just underline the definitions of general pathology and try to remember it. Better if you can note it down in one copy, all the general pathology definitions in one copy or in your laptop, whatever you are comfortable with. You need to remember the definitions first. Then one by one we will go with the systematic, like CVS, respiratory, all the diseases. Accordingly, we will discuss the pathogenesis. And in the practical class, we will show you the slides. Like I was telling about the hematology, like leukemia. Leukemia means abnormal blood cells. How it looks like, how to identify that, we will show you in the practical class. Okay.